Hello, as I promised, this video is on cataracts and it is part of your neuro subject. It is coming out of this cranial nerve packet, and inside here you can turn right to the handout that says cataracts. So what I want to do is talk about the very specifics about cataracts, cataract surgery, risk factor causes. I think you will get a lot out of this video because it's the #1 surgery in America for anyone over 40. Like, this is a pretty common surgery. It is part of your NCLEX exam. These little videos where you have something as specific as eye issues, they're easy checkoffs for you. So this video will be pretty easy, painless, if you will. All right, so here we go. This video is on cataracts. Again, it's from the neuro subject or playlist. It is in your cranial nerve packet. The definition of cataracts is cloudy, opaque lens. The lens of your eye has an opacity to it. Opaque, what does that mean? It means cloudy and that you can't see through it. Back in the day when we had to wear pantyhose, you had this opaque pantyhose. Yeah, like your stockings were opaque. It meant that you couldn't see through it and you could wear them and, you know, whatever. The opposite of opaque for pantyhose was sheer. I'm sure that'll come in handy on the NCLEX, but I'm trying to give you an idea of what opacity of the lens or opaque lens really means, okay? So hopefully you paid attention to that. Now, the causes of cataracts are plentiful, but #1 on any test will be the issue of age. As long as you're 50 and up, cataracts come with the territory. However, it's very gradual in its progression. So at 50, I know I never noticed anything. Even at 60, it's super mild. I probably will need surgery. Well, I will need surgery, but not for a while, according to my eye exam this year. Okay, so 50s is when it starts, but look at this. By age 75, more than half of the patients age 75 or older, over half of them will have cataracts. So it's really common. It can be congenital in the sense that this patient's born with cataracts, but that's not usually what we see. Part of the reason for cataracts can also be a chronic exposure to sun, direct sunlight. That's why you never look at the sun with the naked eyes, right? Or radiation. This direct sun exposure is your UV light exposure. And even steroids. Kind of want to know that. Steroids. Okay. Risk factors for cataracts include diabetes, hypertension, hypoparathyroidism, and you know I'm going to say it, smoking and alcohol. Isn't it always on the list? So let's make sure we put that up here. Smoking and alcohol are risk factors for cataracts, especially veterans who smoke. Might be because of all the dangers and toxins and environmental chemicals that they're exposed to, and then smoking might make it, you know, even worse. But that's something I did note in the literature. Again, risk factors include steroids and beta blockers. Again, the risk factors include injury. Ooh, injury to the head, so head injury, or eye injury, especially a penetrating eye injury. And then intraocular foreign bodies that have gotten stuck in the eyes. Okay, I hope that helps. Now, next is #3, signs and symptoms. What will your patient complain of? Or what might they tell the eye doctor like I did? They may have slightly blurred vision, double vision. They may have decreased color perception. I just had a patient the other day in my unit where I work at the clinic, Cleveland Clinic, And she had just had cataract surgery. She wasn't there for that. She was there for an endoscopy. But I used the opportunity, since I'd just been told I have very mild cataracts. I was like, how did it go? Like, what was up with it? Like, what'd you think? And blah, blah, blah. She goes, oh my God, I love what I see now. I can see colors very vividly. So I thought, wow, that's interesting. So when I saw this in the literature, that if you have cataracts, you have a decreased color perception, her comment made perfect sense. Decreased, this is key. I think you might want to put a star by this one. Decreased night vision, especially while driving. Big deal, because that's what I told my eye doctor. Okay. A late sign is a bluish white pupil. The cataracts themselves are painless, thank God, because your girl's a wimp. So cataracts are painless. It may feel like, and I remember saying this to the eye doctor, it may feel like your glasses are always dirty. This patient can have difficulty reading the street signs, especially at night. They may complain of a glare or halos. I see a mild glare. And a well-lit area will improve their vision. This is for all those little nurses I work with that are young, and they always want the lights off when we first come in the morning. And they're yelling at me when I work there and I turn the little lights on, because my old ass is blind without light. And I'm like, shoot, y'all, I can't see. They was like, oh, Dr. Shelly, shush. All right. Now, number 4, how would we diagnose this? How is this diagnosed? Well, I just told you. Diagnosis is done through an eye exam through the ophthalmologist after they dilate your pupils. So they dilated my pupils. They took me back for the actual exam. There is a loss of the red reflex, and you can actually see that the lens is opaque. Kind of simple. No extracurricular activity here, okay? And it doesn't hurt to get this eye exam. I don't know if I said that. All right, now, number 5, what is the treatment? Because there is no cure. So what is the treatment? Surgery with a lens implant after we remove the cataract. We only do one eye at a time, so this is unilateral. We'll come back in a couple months and get your other eye. And it's on an outpatient basis, and usually discharge after this surgery is within an hour. Wow. Now, you, my love, are the nurse, so let's take care of this patient. What we gonna do pre-op, y'all? I ain't gotta keep talking. You can fill in these blanks. Consent form. Make sure the patient has a driver. Check for any anticoagulations in the last 5 to 7 days. Mydriatic eye drops to dilate the pupils. Mydriatic, let me help a sister and a brother out. There's the D for dilate. Remember I said that. And the patient's going to get anti-inflammatory eye drops before the procedure. We will be using Tylenol for pain relief after. Make sure you don't say aspirin, okay? All right, shouldn't be that big a deal though. So listen to this. After surgery, blurred vision is absolutely okay. Remember I said that. That's often a very common test question. All right, now, complications following the surgery. Number 6, retinal detachment, infection, hyphema, which is going to give this patient extremely painful blurry vision. This is not painful. This is because of a collection of blood in the eye, and lens dislocation. So also, cataracts happen to be one of those focus areas that I teach you might be a reason to call the doctor first. Now, I'm going to talk about that in a little bit, but let me finish what your post-op care of this patient is. Number 7, the post-op care of the patient having undergone cataract surgery, and some of the things to teach the patient to call the doctor for. That's what number 7 is. First is painful blurred vision. I'm going to say that again. Painful blurred vision. Remember, we expect the vision to be blurry, but painful blurred vision is not allowed, right? So you'd call the doctor for that. So watch this, you guys. Blurred vision's okay. Sandy, feeling like sand is in the eyes is okay. I'm gonna say that again. Painless blurred vision, feeling like there's sand in your eyes, this is okay. It is not a reason to call the doctor. It is not a reason for this patient to go to the emergency room. These two complaints should improve. The sandy feeling in the eyes may take about 6 to 8 weeks. The blurred vision will improve within a day or 2 or 3. Like, that part gets better relatively quickly. The patient will be taught to wear a patch over their eye at night to prevent corneal abrasions or from them scratching their eye. The patient will be taught how to administer eye drops. The 2 types of eye drops that the patient will get is antibiotic eye drops and steroid eye drops. We teach the patient to keep their head of the bed up about 45 degrees. We give this patient intraocular pressure precautions. You may remember them as intracranial precautions, intracranial pressure precautions. They're kind of the same. So listen to this. No lifting, anything greater than 10 pounds. No bending, right? No Valsalva, so these patients may get a stool softener post-op. No coughing, sneezing, or blowing their nose. No hyperextension of the neck or hyperflexion of the neck. No holding their breath for any reason. So these are very common things we teach to the patient who's had eye surgery for anything, okay? Intraocular pressure precautions. We don't want the pressure to go up in the eyes, right? I mean, you know. Trying to think here of anything. Oh yeah, no driving until you're cleared by the doctor. So these intraocular pressure precautions, no driving. This is probably the most important issue of all. This patient needs to have the full awareness that they will be followed up with an appointment to come in and get checked by the doctor within the next 24 hours. Follow-up is the next day. They got to come back, and generally, obviously, they got to have a driver. The nurse in her care of this patient for that hour or 2 post-op is checking for increasing tears, increasing drainage, increasing pain and edema, bloodshot sclera, green or yellow discharge, and any bleeding. All of those are reasons to call a doctor, right? The nurse is going to give basic care and comfort. Basic care and comfort includes cool compresses, Tylenol for any discomfort, dark glasses, especially outside, and even in the home with bright lights. She's going to teach that a creamy white or dry, crusty discharge drainage is normal. And then she's going to teach when the patient should call the doctor. Sudden eye pain or eye pain that is getting worse after it had gotten better. decreasing visual acuity when this should have been improving visual acuity, complaints of floaters, complaints of severe bruising and increasing swelling, bright flashes the patient might complain about, photophobia, dark spots in the visual field. Remember, the complication could be retinal detachment with some of these complaints, and that's why you do a lot of teaching. Now, look at this. There are 5 reasons for the nurse to call the doctor first on any NCLEX exam. In other words, your first nursing action needs to be call the doctor for 5 reasons and 5 reasons only. No one gets all 5. Usually you average 1. This surgery is one of them. So we often say that the mnemonic for when should you call the doctor first is called RECCC, which means RECCC, RECCC. The R is, we call the doctor first for ruptured uterus. The E is for epiglottitis. The C is for consent form not signed, or the patient doesn't know what's going on. Another C is for compartment syndrome with the cast. And the last C is for complaints after cataract surgery, because basically any complaints after cataract surgery is a call the doctor for the nurse, because it could be retinal detachment and it's so serious. I hope that helped. Deuces. Oh, I forgot to tell you, I can't wait to see you January 17th, 18th, and 19th for boot camp in Cleveland, Ohio. I mean, bring your colored pens, bring your highlighters, bring your smile. Let's get ready to have a lot of fun. Remember, we have a 3-day boot camp, Friday, Saturday, and Sunday in Cleveland, Ohio, every month or so. And here we teach you how to pass that NCLEX. Deuces.